Hey y'all, it's Lindsay. Once again, on the road again. Heading to Norman. Let me get y'all positioned here. Make sure nobody's behind me. Heading to Norman to see. Hang on. I know it's a bad position, but it's the only way I can get it to work. So, heading to Norman to see my rheumatologist. Sorry about the light. Not a whole lot I can do about it right now. That was a bad back pain. Bad back pain. So for those of you who may be new to my channel, or any of my friends that I haven't kept in touch with over the years that may be watching, if you don't know, I do have an autoimmune condition. It is called ankylosing spondylitis. It is an autoimmune arthritis of the spine, the SI joint, the hips, and other larger joints in your body. I also have fibromyalgia as a secondary condition to the ankylosing spondylitis. I typically take injections for the arthritis, and they are immunosuppressants, like you've probably seen Humira and Enbrel, things like that advertised on TV. I have taken Humira. It was the first immunosuppressant that I was put on, and it was hell. I do not ever want to be on that drug ever again. I would take that medication, and within a couple hours, I would be sick to my stomach. I would be weak. I could barely keep my eyes open. I had no energy. I would have to miss work the next day because I would have to recuperate from taking that shot. And it hurt. It's out of every shot I've ever had, it hurt the worst. I swear to you, it hurt worse to take that shot than it does to get an IV. And that's coming from someone who has terrible veins and gets poked like a pincushion. That shot is just evil. Don't ever want to do it again. I've also taken Enbrel, and it didn't give me the bad side effects. It didn't hurt that bad to take that injection. It was a once a week injection. Unfortunately, the Humira and the Enbrel did not lower the elevated inflammation markers in my body. And it is these inflammation markers that kind of attack my spine and my hips, especially my spine. When I first started having the pain, it was I guess it's been about 3 years ago since I've been diagnosed. But I started having the pain way before that. And this particular condition usually presents itself in your teenage years into young adulthood, up to about the age of 30. I think I was diagnosed at 28 or 29. I remember it was shortly after Anthony and I got married, but I was in terrible pain, and I couldn't figure out what was wrong. So I went to the chiropractor, and even through all the treatments that I had there, it just wasn't getting any better. And so when I went to the doctor and I told them about, how it was hurting so bad in my lower back and my hips, there were days that I didn't want to get out of bed because it hurt so bad. I couldn't do anything. They immediately asked, have you been tested for lupus or RA? And I was like, no, I've never been tested for autoimmune stuff. So they did a test, and it came back that I did have something going on in my body, that it was something was causing my inflammation markers to be high. And when I say my inflammation markers are high, I can't remember if it's the C-reactive protein or if it's the SED rate, but one of them should be like 0 point something. Mine is 3 point something. So it is highly elevated there. So after that, the first doctor I was sent to was terrible. She barely examined me. She blamed it all on my weight, of course, and just told me I had fibromyalgia and there was nothing she could do to help me. I was just going to have to live with it. As time went on, the pain just kept getting worse. And it didn't feel like just muscle tissue pain. It was joint pain. It was this terrible back and hip pain. It was in my legs. It was in my knees. It even started in my ankles. I was having swelling in my arms, around my elbows. You know, some of that was related. Some of the pain I was feeling, I did have that muscle pain and the fatigue that comes with fibromyalgia, but this was just escalated to a completely different point. So, it got to the point that I would literally, I missed a lot of work during that time. Fortunately, I was able to work from home a lot and do what I could, but I was exhausted all the time and I couldn't get out of bed. It would take me an hour or two to even feel somewhat normal after waking up. My husband and I would make plans to go do something, and just doing one little thing, I was done. You know, we couldn't do anything else. I just had to go home and lay down. I can remember laying in bed and feeling like I was actually dying. Like my body was literally in the process of dying. It hurt to breathe. It hurt to move. It even hurt to have the bed touch my back. And I would cry. I would lay there and I would cry. It's the most pain I've ever experienced physically. Even after having the gastric sleeve and everything, this by far was the worst pain that I'd ever experienced. So I knew something more than fibromyalgia was wrong. So I talked to my doctor and they got me another referral to see a different rheumatologist. And I went to this appointment and I wasn't, after the last one I had, I wasn't very hopeful. I figured they would just say, you know, that it was all in my head, that I was crazy, there was nothing wrong with me. But he didn't. He fully examined me and my joints and my back. He did x-rays, which the other doctor did not do. He looked at my blood work, saw what was elevated, asked about my family history, because there was a lot of back issues that in my family. Both of my parents had really bad back issues, but my dad especially did. And typically men present with this disease more prevalently than women. And in women, it can present differently. So based on my family history, he decided that he was going to test me for the genetic factor that shows up with this disease. I did test negative for that genetic factor. However, that didn't rule out what was going on with me, and it didn't rule out the possibility that that's what this problem was. My x-rays came back and they were pretty bad. I have discs that are and vertebrae that are compressing in my spine. I've actually shrunk about 2 inches because of that. And I have bone spurs on my spine. And definitely not comfortable good things. And you know, I'm 31 now, and you wouldn't expect at this age to have the spine or the back of an elderly person. But that's what I'm looking at, and it makes exercise very difficult. Even though exercise is supposed to help it, it makes it very difficult. But the treatment options that I've been on, like I said, I was on Humira, I was on Enbrel. They did not lower the inflammation levels. Tried prescription NSAIDs, anti-inflammatories. I had an allergic reaction to that. It was an anaphylactic reaction. That was not fun. And then since then, there's been a fairly new drug that's come on the market called Cimzia. And Cimzia is designed specifically for people with ankylosing spondylitis. And it is an injection that you take every 2 weeks. I have no side effects from it. Shot doesn't hurt. Really doesn't hurt that bad. I mean, it might sting a little bit, but it's no big deal. I feel like it was working well for me. And then I ended up having to miss an appointment because I couldn't get my blood work done, which is when you're on an immunosuppressant and you have all this inflammation in your body. Of course, they have to do blood work every few months to check your blood cell counts and to check your inflammation markers and to make sure that everything is okay, because these immunosuppressants, I believe they're TNF blockers, they can cause cancer. So they have to, that is a side effect that they have to watch out for. Well, I missed my appointment in October because I couldn't get away from work that day. So they could not refill my Cimzia prescription. And that meant that I would have to wait until January to see the doctor and get blood work done. So that meant I had to go without Cimzia since November. And the back pain has been coming back, especially after surgery, because we all know hospital beds and stretchers and all that crap are uncomfortable. So it was really bad after surgery. And this is the kind of pain that even narcotic pain medication, even morphine, doesn't touch it. It just doesn't work for this pain. So even though it helped with all my other pain I had from surgery, it did not help with the back pain that I was experiencing. The only thing that I can take for this back pain is Tylenol, and it really doesn't do anything either. So hopefully today I can get my blood work done and get back on the Cimzia eventually, although because it is an immunosuppressant, you cannot start it if you have any open wounds or infection or anything like that. Well, I have the incision from my surgery that decided to reopen, and that I'm on antibiotics for right now to keep it from getting infected. Therefore, it will be a little bit longer before I can get back on the Cimzia. So I'm just, kind of chasing my tail right now. Today, I am in a great deal of pain. On a scale of 1 to 10, I would say my pain is about a 7. So it is very uncomfortable for me to drive, and I do have to drive 2 hours to Oklahoma City, well, Norman, but Oklahoma City area, to see my doctor. So, yeah, it's going to be a fun drive, and I did not sleep well last night. I had a lot on my mind, especially since I went back to work today. So, tired. I'm in pain. Don't want to drink any more protein shakes. I'm sick and tired of I'm sick and tired of them. Of course, I brought one with me in case I get hungry while I'm on the road or at the doctor's office or what have you. I've got my water bottle all filled up and ready to go. My husband got me a cool water bottle for Christmas, so got that ready to roll. And this is just kind of random, but does it bother anybody else that whether it's a sports bottle of water, or if it's just a regular bottle of water or a glass of water, that for whatever reason the air makes it smell fishy or like a wet dog? Like, I pick up this water bottle and I go to drink from it, and I swear to you that is all I smell, is like this fishy lake water smell. I mean, is it just me that experiences that? Because I have to hold my breath when I go to take a drink, because that smell makes me want to throw up. I can't deal with that. I definitely don't eat fish, so I don't want anything to smell like fish either. But anyhow, so I have rambled on for almost 20 minutes here. So tomorrow I will go see my therapist to help save my sanity, because it's been difficult, people. It has been a difficult 3 weeks, and yes, I am 3 weeks post-op today. From liquid diet, from pre-op diet to today, I have lost 45 pounds. I feel lighter. I feel a little better, but it's kind of weird to be this size again. I kind of forgot what it felt like, which I know it's going to get even weirder the more weight that I lose. And anyhow, I go Wednesday back to my surgeon's office to see his PA for them to check my incision that has not healed again. And I'm gonna have to ask her. I'm gonna start soft foods tonight. I'm just starting out with yogurt, but I'm gonna have to ask her, am I eventually going to be able to eat grilled chicken or something like that while I am on this soft food diet? Because I don't eat fish. I I would starve. I would drink a protein shake the rest of my life before I would eat fish. I can't stand it. So it's like, am I ever gonna get to be able to eat like a really moist piece of chicken? Like, can I do that? Is that ever gonna happen? Because when I go on my trip in February, the restaurants that they usually take us to, doesn't really, I mean, it's gonna be on the Gulf. It's gonna be in Mobile, and it's a lot of fried stuff. It's a lot of seafood. It's a lot of, you know, rice and cheesy grits and mashed potatoes or a baked potato. Soup's not really a big option. Or they take us to an Italian place where there's pasta, and I can't really eat the pasta. So, you know, it's going to be interesting. Hopefully they can meet my dietary needs, but I'll probably have some protein shakes just in case. So, yeah, it's going to be interesting Wednesday because they're going to have to, like, I got a list of recommended foods, but there's not much on the list. And if you have to eat out, it seems almost impossible to do. So, anyway, so I've rambled on for 21 minutes, so I guess I will let you guys go. But I will be back Wednesday when I have the official weigh-in at my surgeon's office, and I will let you guys know where I'm at. So I will talk to you later. Bye.